Many people don't realize that Georgia, as the nation's 8th most populous state, is historically one of the youngest states, but is going to be one of the fastest states in terms of older adults over 65 years of age. And along with an aging state is the really important consequence of Alzheimer's disease and related dementias. These are often missed in primary care and general practice, and the Georgia Memory Net line item budget in the state of Georgia allows primary care providers, general practitioners, and other providers to screen, assess, and detect for cognitive impairment. Now, the Georgia Memory Net puts in specific funding for 5 regionalized memory assessment clinics. These clinics are located across the state of Georgia with the intent that these services will be closer to Georgians in terms of where they live. So the notion is that the state funding provides support for physicians to work in these memory assessment clinics, neuropsychologists, and also that important link of community service education. So it's a very important and revolutionary project that will benefit all Georgians. The 5 memory assessment clinics are modeled after the protocols and procedures of the Alzheimer's Disease Research Center. They also have the benefit of physician providers, neuropsychologists, and community service educators. These memory assessment clinics are connected to the central hub of the Alzheimer's Disease Research Center, and therefore they have access to national experts in Alzheimer's disease and related dementias, and therefore can leverage those resources in a way that allows the achievement of an early and accurate diagnosis of the cognitive impairment that the individual is experiencing. As designed, this is a 2-step, 2-visit process at the memory assessment clinic. The first element is a detailed and comprehensive neurological examination to help define a definitive diagnosis for the patient. The next step is an assessment of the care arrangements that the individual and the family are currently able to provide, as well as a detailed assessment of resources that are available into the community and the development of a comprehensive care plan. This is handed back to the primary care provider and to the community local resources that will help serve this individual and his or her family. One of the things that the memory assessment clinics do not do is they do not provide ongoing medical management for the patients. That's a warm handoff back to the primary care provider. Additionally, the Georgia Memory Net does provide a collaborating and coordinating resource for community services providers in the patient's neighborhood who will provide the bulk of ongoing support and services. Memory assessment clinic referral happens after an evaluation by a primary care provider. Primary care providers may have detected something during the Medicare annual wellness visit, the portion where there's a cognitive assessment, or there may have been a concern that's been brought up by either the patient or a family member about some sort of memory loss. The memory assessment clinics are available to primary care providers through a variety of mechanisms, via fax, via telephone call. It's meant to be as easy as possible. The memory assessment clinics are not intended to be an assessment for someone with serious psychiatric illness or with closed head injury, but rather for people who are struggling in their communities with Alzheimer's disease or related dementias. Someone who is bedbound in a nursing home with advanced stages of dementia probably wouldn't benefit from a memory assessment clinic visit. A Georgia Memory Net supported memory assessment clinic during that first visit does a protocol-driven neurologic assessment and an evaluation by a neuropsychologist. With these pieces of information in hand, an initial care plan is developed, which leads to the second visit. So a lot of things happen after the second visit. The first category of things is that there's a handoff between the medical evaluation team and the primary care provider. The memory assessment clinic provides a detailed accounting of the assessment, of the diagnostic testing results, of other laboratory results and the initial diagnosis. If there are any medication alterations or recommendations, that's also provided back to the primary care provider. The second category of handoff has to do with the community service educators. The community service educators, expert in this area, are outreaching to the area where the patient and the family came from to be in contact with the Area Agency on Aging, the AAA, and also the regional chapter of the Alzheimer's Association. With the input of the Alzheimer's Association and the Area Agency on Aging, the family and the patient have the best chance to live independently in their home and in their community. There's a care plan that is issued, and the patient and family are instructed in how to use that care plan, and they get ongoing input from these experts local to their homes.